last week with a Dr. Dror from Israel, and he felt it was a small study. I don't think the sample's enough that you could write home about it, but he found that people who were vitamin D deficient were 14 times more likely to get severe COVID and 11 times more likely to die. I also talked to a Dr. Meltzer from the University of Chicago. I'm not going to quote his numbers, but I think it would be accurate to say that he feels that over half of the COVID deaths could have been prevented with adequate vitamin D. And a guy by the name of his name is Carl Flieger from Stanford, who maybe similar amounts. And I've tried to, in my own little world, publicize it. But when you're talking about a life savings of that amount, it's very frustrating to me that you, and I'll include your predecessor in the group, have done nothing to publicize that. I mean, you can't turn around without running into things about social distancing or masking or vaccinations, enough that everybody has heard these things millions of times over. But the fact that and of course, if you publicize vitamin D more, not everybody would take it, just like not everyone gets a vaccine. But I think you can get a lot of people to take it, and it's apparently good for other health problems other than just the COVID. I mean, you talk about 11 times less likely to die, it's kind of a big number. I wonder, in my district, people are beginning to feel that the reason that the establishment doesn't push it is because you can get a big bottle of vitamin D for $20 at Walgreens, and they'd rather, that there's no money to be made in it, so we don't push it. But could you give me your opinion of vitamin D and say in the future, with all the money you have floating around, may you want to tell about these, publicize it a little bit more for people?
Congressman, thank you for the question. No doubt that vitamin deficiencies lead to a lot of different consequences in the health of so many American people.
11 times more likely to die.
And so what I would say to you is that the health professionals and the scientists at Health and Human Services, whether it's at CDC or FDA, NIH, I know that they are doing some extremely important, some of the most cutting-edge research, and I'm not prepared to give you exactly what they're doing right now on the issue of vitamin D, but I'm certainly willing to follow up with you. But I agree with you to the point that vitamin deficiencies can lead to lots of consequences for folks, and so we know that there are real efforts should be underway to make sure that we're doing the things that are most basic and cost-effective to try to keep people healthy.
Well, I mean, there are so many studies out there. Now, I think the problem they have is all these studies show correlation, not necessarily causation. But when you have things like 11 times more likely, and I can give you these names of these professors from around the country. I mean, the idea that we're 2 years into this pandemic, and I guess even Dr. Fauci, who I have a low opinion of, I guess even he has privately told people how much vitamin D he takes. But for some reason, when he gets on TV, he zips his mouth. And I do feel, and like I said, your predecessor's in the same boat, because I certainly tried to publicize it before Biden was elected. Couldn't get a lot of movement then either. But I want you to look at it and maybe publicize it, and maybe you can cure, we could have saved a lot of lives. I mean, I think 300, 400,000 in my opinion. But I talked to you in the Labor Committee with regard to what I felt was too much emphasis on racial groups, that sort of thing by your agency. I'll mention here, maybe you recognize it, new payment model for physicians who implement anti-racism in their care plan, and an implication in some of the monoclonal antibodies distribution that race should come into play. I have the documentation here. Do you feel your office is emphasizing, I mean, to me, a person's a person. I will say, with regard to vitamin D, they could have emphasized that dark-skinned people are more likely to be vitamin D deficient. I think I'm the only one who talks about that as well. You could have really saved a lot of lives there. But yeah, do you feel you're pushing this divisiveness by race a little bit too much in your agency?
I'm going to have to say the gentleman's time has expired.
And Congress, Mr. Chairman, I can answer it's expired,
Okay.
but I would say no, the answer is straightforward, no. We're looking towards equity to make sure no one's excluded.
I thank the Secretary for that quick response. I now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, it's always good to see you. Thank you. Good to have you back. Thank you. And thanks for being here. I was really pleased to see in the proposed budget regarding the Indian Health Service